Hello and welcome. This is a PowerPoint presentation on the impact of the Affordable Care Act, the ACA. The group members you're receiving this information from are Kristen Newton, Anita Nema, Genesis Reynolds, Ashley Robinson, and Chris Simmons. This PowerPoint is being created on behalf of the University of Maryland Global Campus for the Healthcare Administration course 620, the United States Healthcare System, for Dr. Timothy White. This presentation will examine the impact of the Affordable Care Act on healthcare access, cost, and quality. In order to do so, the following objectives will be discussed. Status of those who are newly covered, define exchange, and analyze how various states utilize them, Medicaid and the Affordable Care Act, impact on health insurance premium, politics impact on the Affordable Care Act in regards to cost, access, and quality of care, key challenges facing state and national policymakers, and the Affordable Care Act, an analysis of whether the implementation of the regulation is either good or bad. An overview of the Affordable Care Act. The Affordable Care Act, also known as Obamacare, and the Patient Protection and Affordability Care Act, PPACA, was enacted by President Barack Obama on March 23, 2010. The Affordable Care Act is a healthcare reform that aims at creating a better healthcare system by reducing costs, increasing quality, and improving population's health. According to the United States Centers for Medicare and Medicaid Services, there were three primary goals that the Act set to achieve, which included making affordable health insurance available to more people, expanding Medicaid programs to cover all with incomes below 138% of the federal poverty level, and supporting innovative care design to lower the cost of health in general. Since the implementation of the Affordable Care Act in 2010, several changes have occurred. Those changes come from immense pressure from Democratic members of Congress. In 2013, the government made more delays on some requirements stipulated in the Affordable Care Act. President Obama signed a law that delayed the implementation of the Cadillac tax, which required 40% excise tax on high-cost health plans. The IRS also delayed the requirement for the insurers to report coverage information. Moreover, the United States Supreme Court on June 28, 2012, ruled that the federal government requirement to withhold part of Medicaid finance from states did not comply with expanding eligibility of Medicaid and was unconstitutionally coercive. This made the expansion of Medicaid a voluntary option. In addition, most of the health plans developed between 2010 and 2014 were not complying with the Affordable Care Act requirements. And such the case are grandmothered plans. This prompted the federal government to delay compliance, allowing insurers to continue to providing plans until 2015. The administration also delayed grandmother plans, employer mandate with 50 or more workers to offer affordable health coverage to full-time employees, and the requirement for everyone to enroll in health insurance at the start of 2014. Coverage underneath the Affordable Care Act. If you looked at the comparison between 2010 and 2016, as shown on the screen, in 2010, there was 48.6 million of uninsured individuals in the United States. In 2016, that number dramatically decreased to 28.6 million. That was in part due to the coverage options offered underneath the Affordable Care Act. There was expansions to Medicaid. There was a creation of the health insurance marketplace, ACA the exchange, and then also revisions made to the private insurance. So you may be wondering, what are exchanges? In 2013, health insurance exchanges, also known as the health insurance marketplace, was established underneath the Affordable Care Act. The marketplace is an interactive platform that allows individuals who are not covered by their employer and small businesses to compare medical insurance plans side by side. The purpose of this platform is to create an outlet for people to search amongst high quality coverage options and select based on their specific needs and costs. The intent to be able to compare available plans encourages competition between insurance plans and makes insurance prices more affordable. Additionally, plans are offered in 4 metal categories. Those categories are shown on your screen. It includes bronze, silver, gold, and platinum. The categories are not indicators of quality of care, but moreover, it defines the cost split between the plan and the individual. The marketplace provides the individual with an opportunity to determine what costs they will incur, which includes premiums, cost sharing, and deductible. The illustration on the right shows a breakdown of what each level has to offer. How are different states approaching the exchange? Each state determines if they would like to develop and host their exchange or let the federal government establish and run the exchange. If a state does choose to develop and operate its exchange, there are certain functions the exchange must achieve to do so. Additionally, another option states have is to operate their own marketplace, but partner with the federal government for eligibility and enrollment functionality. Consumers will utilize the federal website to do so. Currently, the breakdown of exchanges is utilized by states as follows. 15 states have state-based exchanges, 6 states have state partnership exchanges, and 30 states have federally facilitated exchanges. The map on the right is from the Kaiser Family Foundation and shows what type of health insurance exchanges each state utilizes. Medicaid revisions. One major part of the emphasis of the Affordable Care Act are the revisions that are made to Medicaid. Since its enactment, the Affordable Care Act has had a great impact on Medicaid. First, it expanded the eligibility of adults with income. Medicaid and CHIP Payment and Access Commission states that the legislation expanded eligibility of individuals with income reaching 133% of the federal poverty level. The Act also did the same for children. This prompted some states to move older children from CHIP programs to Medicaid. It also made it mandatory for one to make a single application to Medicaid. In addition, Medicaid revisions also aligned the state's minimum Medicaid eligibility for children. Also, it raised the federal share of Medicaid payments by nearly 1% for particular preventative services. The diagram on the screen shows the impact of the Affordable Care Act on health insurance premiums. As you take note, in 2015, insurance premiums were lowered by 2%. In 2018 to 2019, there was a slight rise in the insurance premiums. In 2019 alone, premiums did decline, and they have been stable since 2020 until now. You may be wondering what variables play a role when it comes to the political debate in regards to the impact of the Affordable Care Act. Since the enactment of the Affordable Care Act, many debates have been made on both sides, whether it is a success or a failure. Most of those debates have been politically influenced in regards to ballots and driving out people to the election polls in order to get reelected into office. The primary areas of concern for the ACA are affordability, ease of access, and quality of care. When it comes to improving the quality of care, establishments of new boards, agencies, commissions, and entities from the government have been created. Also, increased provisions on medical practices. The Affordable Care Act has increased the number of insured Americans due to access of care and greater use of health services. Utilization of primary and specialty care services and access to prescription drugs has also been higher among low-income adults in the Medicaid expansion states than in non-expansive states. To date, the findings on the effect of the Affordable Care Act on outcomes are mixed. Studies have examined that the health effects of the Affordable Care Act have compared Medicaid to non-expansion states with those that have expanded. In general, the mortality rate from cardiovascular among middle-aged adults and mortality from end-stage renal disease has decreased. This in part is due to preventative services, as well as the establishment of primary care services, which is more widely available due to the accessibility of the Affordable Care Act. Decreasing costs on healthcare. The cost before 2010 and the cost today of healthcare has significantly been reduced. This has been in part due to cost containment, the inability of states to increase their prices because there are more strict regulations. Key challenges facing state and national policymakers. The inability of all states to adopt the Affordable Care Act has greatly been a challenge that has been seen. Although guidelines are in place to fund those states that utilize the marketplace and expansions to Medicaid, those that have not done so have also received government funds. As a result, those residents in those states have higher premiums, which places a large financial burden on those residents. Policymakers in 13 states have also failed to adopt the Affordable Care Act Medicaid expansion. 37 states and DC have also accepted the federal funding to expand Medicaid under the Affordable Care Act. This chart shows the average cost of monthly premiums from 2011 into 2019. So now let's discuss whether the Affordable Care Act is good or bad. If you remember from the beginning of this PowerPoint presentation, we stated that there were 3 primary goals of the Affordable Care Act. Those goals focused on the improvement of quality of care, decrease healthcare costs, and increase of number of those individuals that are insured. In review of quality of care, we must look at prevention and wellness strategies. The Affordable Care Act did make those services more available and accessible to patients through the use of primary care and specialty care facilities. There's also been a greater emphasis on the quality of care versus quantity of care. In many instances, medical practices often focus on quantity opposed to quality due to the reimbursement of funds. Because of the Affordable Care Act, there has been an increase in the quality of care that individuals receive due to the funding from the federal government and state bodies. There's also been increased coverage for those with pre-existing conditions. Prior to the Affordable Care Act, employers had the ability to deny insurance coverage to those individuals who did have a pre-existing condition. Since the Affordable Care Act has been in place, that is no longer an option. We also have increased healthcare access, enhanced healthcare outcomes. Those two are directly correlated with one another. Because individuals have more access to healthcare, their outcomes in a healthcare facility are also increased. The Affordable Care Act also did a great job in decreasing the number of disparities between men and women. On average, women for their services to get seen by a medical provider because they tend to have more medical issues, such as pregnancy. Another analysis of whether the Affordable Care Act is good or bad are health. As we stated before, there is cost containment. Premiums are more controlled, and employers don't have the ability to raise premiums due to health conditions. There's also been a reduction in healthcare costs in regards to pharmacy provider and hospital. On the flip side, there has been increased compliance costs due to more regulations that are in place for healthcare providers, and a slight rise in insurance premiums. As we noted before, between 2008 and 2018 and 2019, we did see a great influx in insurance premium cost. Lastly is the number of insured individuals. One of the main goals for the ACA was to increase the number of those that are insured. By doing so, the act opened up the marketplace for those to be insured. This was done through expansions within Medicaid, subsidies for private insurance, and reforms within the marketplace in general. Medicaid expansion happened due to coverage that was contingent on income versus individual factors such as pregnancy, age, or disability. This also increased the eligibility of those individuals who were at or below 138% of the federal poverty level. In regards to private insurance, individuals have the ability to purchase private insurance for persons without access to employer or public programs. That in hindsight means that if you were not employed and you were not eligible for a public program, you were still able to purchase private insurance. This was done through the creation of marketplaces for the exchange system, as we discussed earlier. There was also an added benefit of cost sharing assistance, which is for persons with lower income who are not eligible for public programs, but also may struggle with meeting the needs of their medical. Lastly was the reforming of the insurance market. This expanded the coverage for those with pre-existing conditions and also placed limitations on premiums. The ability for someone to increase a premium due to age, family size, geographic location, and smoking status. Those are the only variables in which a premium can be increased. So in conclusion, the Affordable Care Act has helped millions of Americans gain health insurance. Since its enactment in 2010, the Affordable Care Act has been subject to many delays. It also caused changes in Medicaid, causing its expansions in some states and not in others. And lastly, the Affordable Care Act has caused an increased decline and stability in health insurance premium. I hope you guys enjoyed this PowerPoint and found it very informative on the impact of the Affordable Care Act.